The Asian American Pacific Islander Nurses Association of Nevada presents Healthy Mondays with Apina of Nevada. Start the week healthy and right with interesting conversations on living a healthy lifestyle. And now, your Healthy Mondays host, Dr. Mary Faye Axon Armstrong.
Aloha! Magandang gabi po sa inyong lahat. Maraming salamat po sa inyong pakikinig sa aming programa, Healthy Mondays with Apina of Nevada. I'm yours truly, Dr. Mary Faye Axon Armstrong, founding president of the Asian American Pacific Islander Nurses Association of Nevada and professor at Roseman University College of Nursing. You might be wondering, I'm saying magandang gabi, but then it is daytime. So we're pre-recording this show. I am very excited to show you where I am broadcasting from. I am broadcasting live from Henderson, Nevada. This is probably about, I wanted to say 15-20 minutes drive from Las Vegas Strip. And you can see this is Whitney Ranch hiking trail. I'm supposed to be walking today and I forgot that I am broadcasting and pre-recording for our show. So you're probably wondering, oh, okay, why is she wearing mask? No, you shouldn't be wondering why I'm wearing mask right now. But the month of October is really dedicated from one of our health awareness. The month of October is Lung Health Awareness Month. And so I have a very special guest tonight who will be able to help us with increasing our awareness with keeping our lungs healthy. And that's why I'm walking right now. So you're going to see I'm hiking and walking. And I wanted to introduce to you someone who have just recently got acquainted with. And her name is Angie Wolf. Welcome to our Healthy Mondays with Apina of Nevada, Angie.
Aloha. Good morning.
Yeah.
Good morning here.
Good morning here. But
Thanks
when you see this,
for having me.
Oh yes. I mean, it's really timely that when we started getting to know each other, and you mentioned about your specialty about lung cancer and the things that you do as a nurse. So Angie Wolf is also a nurse. So maybe I will have her the opportunity to share about her background to establish her expertise in Lung Health Awareness Month. Go ahead, Angie.
Okay. I am a BSN prepared nurse that is a nursing student for my MSN, but I have been a nurse care coordinator and I've been in that role for about 3 years now. I did interventional pulmonary, and that is a medical specialty that is responsible in the diagnostic testing of lung cancer. And that has made me a very passionate about lung health and advocating for those patients and lung health in general. As you can you can probably figure out that smoking and other things and vaping, I've been passionate about trying to spread awareness about how unhealthy that is and things that we can do to prevent the start of our young people from beginning
Thank you for
using
that
tobacco products.
Yes, thank you for that synopsis of what you do as a nurse. And I thought, this is something new that I'm broadcasting here live out in the environment. And I think, we always want to be more intervening with more on intervention and then more on prevention. I think what I'm trying to say is preventing us from having the lung cancer. And so the first thing that came to my mind is, oh, why don't I show them when I exercise on the weekends? It's hard to do it on the weekdays when you're all have your schedule, but on the weekends when you have the time, like the earlier the better to avoid the heat. But right now, I wanted to show our listeners out there what I'm seeing in front of me, just quickly. So this is here in Henderson, Nevada. I'm actually walking on the Whitney Ranch hiking trail. And one of the things that I thought of, especially the recent fire in California, in one day, I think it was noontime, I looked out and I saw the sun. It was orange. And then
Mhm.
I posted it on Facebook and everybody said, oh, it's from the fire from California. So in addition to smoking, cigarette smoking, I think it's, the environment that also contribute to targeting our ability to keep our lungs healthy, right?
Right.
So
And I'm on the West Coast. I'm in Oregon, and it's been especially hard here with the smoke. It's been really bad. It's better now, but there was a week there where you can go outside. It smelled like you're walking into a campfire. Um, it was pretty bad, and so the patients um, that I advocate for and do care coordination for, that was especially a hard time for them. Um, Patients with pulmonary illnesses such as asthma and chronic bronchitis, COPD, emphysema, interstitial lung disease, sarcoidosis, and fibrosis, and also on top of that, we have this pandemic that is also a lung illness. And so times are especially hard for this group of patients. And it's so sad. But yes, exercise, getting out there and exercising is definitely one of those things that helps keep your lungs healthy, exercising and expanding your lung capacity. Did we lose?
you're speaking, but thank you for mentioning about all those chronic preventable diseases that you mentioned. And I wanted to share, I love sharing stories, personal stories, and stories about, people that I know who had suffered from the chronic disease that we happen to be talking about. My own father died of complication of COPD. He had end-stage emphysema, and it was no fault of his own because what happened was he was taking care. My mom and him were taking care of my auntie, younger sister of my mom, who had tuberculosis, and my dad, in the process, contracted tuberculosis. So it really damaged his lungs, as you know, as a nurse. The alveoli all collapsed and all scarred and no longer able to grab that exchange of carbon dioxide and oxygen. So I remember during his last months or even years of his life, every New Year's when the fireworks are going off, we have to rush him to the emergency room and end up see there's a airplane flying above him. And
It's not loud though.
yeah, okay, good. So every time we have to rush him to the emergency room, and then they have to do a tap to remove the excess fluids in his lungs. And then after that, he's okay. He will be intubated, and then he'll be sent home. So
And
I think having said is very important in keeping our lungs healthy.
And that's a good point that you made. There are every year the American Lung Association, they help thousands of people manage their lung disease and overcome tobacco addiction and live healthier lives. And there are an increasing number of patients that are getting lung cancer that have nothing to do with smoking, although that is the majority of the patients. that develop lung cancer is patients that smoke.
I think
But
secondhand smoking is the worst.
yes,
Yes.
secondhand smoking, yes. But a lot of lung cancer patients, they do have to go in and they have to have their lungs tapped to get rid of that excess fluid. That's one of the things that happens when you do get lung cancer as well. And but
For our, go
go
ahead.
ahead.
For our listeners out there, I was wondering, do you have some statistics about the prevalence of lung cancer, COPD, asthma?
I wrote down that lung cancer is the most common type of cancer worldwide, and then around 228,000 new cases are diagnosed in the United States alone yearly, or this year, and they're mostly among smokers. That's all the statistics I wrote down. They're increasing the screening for individuals that are at risk for developing lung cancer. And that's another thing that I've been a part of that I wanted to mention, because it's becoming more and more prevalent. And the earlier you diagnose cancer, if you can catch it in the early stages, then you have a much better chance of surviving. We can catch lung cancer in stage 1, stage 2, stage 1 preferably, then you have a much higher survival rate.
The early.
Yeah.
So I think what I hear you saying is action, and I think that I have another story, if you can indulge me. One of my, yeah, there's 11 children in our family, and one of my older brothers is a smoker. So anyway, he has this men, and I guess this is very common for men. The macho image that I don't want to go to the doctor because every time I go to the doctor, they find something wrong with me. So towards the end, he had collapsed from work, and then they found out some nodules, multiple nodules all over his lungs, and then there are also some nodules in his spinal area.
Oh.
So long story. I mean, to keep it short, by the time he was diagnosed, it was already at the end stage, and so he was offered radiotherapy to just minimize the large, more palliative. And the thing is, the doctor offered this chemotherapy, a new one, but apparently his cancer cells are aggressive ones.
So he probably had small cell lung cancer. That is a more aggressive one.
Yes. So it's very important for our listeners out there, our kababayans, to get checked. Annual checkups, especially if you already have those risk factors that Angie had mentioned earlier. Get checked by your doctor. Sometimes it doesn't show right away, but if it is an early stage, there are a lot of interventions that can be done to stop it from spreading, and at the same time to continually monitor. So if it is the last stage, the cancer cells already made their damage to the other organs, and that's what happened. It was already metastasized to his spinal area, and eventually, the brain, because we noticed that he's already his cognitive and neural condition is already deteriorating. So, can you tell us any? What is a day in the life of Angie, who had taken care of?
Well, I just wanted to point out the criteria for people that can get surveillance for lung cancer. It's a low-dose CT scan annually, and the screening is recommended for people who are at high risk, and they have to be either currently smoking or have quit within the last 15 years. And then they're in between the ages of 55 and 80 and have a history of a smoking history of over 30 pack year. So you take the number of packs you smoke daily and you times it by the number of years, and that's how you get your pack year.
And you know,
So
sometimes they are minimizing it. So minimizing the number of cigarettes that they smoke. Like it's the same with alcohol. You know, alcohol ingestion, that they would have that.
So you asked me about the day in the life of a nurse care coordinator for pulmonary lung cancer. I work very closely with these patients. We take them on, and even when we've done all the diagnostic testing that we do, we follow them until the end of their lives, and that could be a long time. But we want to keep them close, and we want to keep the surveillance throughout their life, the rest of their lives. And when they do start with us, you can imagine how scared they are. And it's good to have a nurse care coordinator reiterate things and be positive and advocate for them. But we start with getting them in and into our clinic, meeting the doctors. There's several doctors in our clinic. We have a multidisciplinary approach. So we have a team of doctors. We have our HEMONC doctors, pulmonary doctors, radiation doctors, and our surgeon all in one clinic. And then they will start with if we see something that needs to be followed up on, we start with a PET scan, and we have them get a pulmonary function test. And then they come and see us, and then we go over that PET scan with them. And if their pulmonary function test is good, and if it's an early stage, usually they go and see the surgeon, the thoracic surgeon. That's probably the best case scenario that they'll get, is to go see the thoracic surgeon and just have that nodule cut out of their lungs.
And I'm glad that you mentioned, sorry, there's probably a delay. I'm glad that you mentioned about the multidisciplinary team. That's very helpful, because then the person and the family won't have to go from one clinic to another. I remember that, you know, in the olden days where, I feel really bad having them drive over there and get your consultation, and then, oh, by the way, you're going to have a CT scan, and then the pulmonary function test is also somewhere else. So I remember that so well. So now our healthcare system is now leading towards what makes it easier for the patients and their family to navigate the healthcare system. And so, thank you for mentioning that.
And a lot of our patients are coming from far away. So I am coordinating their pulmonary tests and their PET scan all in one day, and coming to see us, that's all in one day. A PET scan, which is a 2-hour test, and the pulmonary function test is a 30-minute test. And sometimes we'll go ahead and ask for a CT scan that helps the doctors in mapping when they do one of their bronchoscopies, to help it navigates them when they go in there and find that nodule. And we'll get lodging for our patients if they're coming from far. And we also offer telehealth now, as you can imagine. That's becoming really a big thing these days, and we already had that in
especially
place.
now.
So, Yes, we were
Yeah,
very lucky that we
especially
already
now
had
with
that in
our
place.
yeah with COVID-19. I think I can speak for what's happening here in Nevada. We now have Cleveland Clinic. There is a Cleveland Clinic here, and also some of the researchers. I think some of the focus is the Asian American Pacific Islander population because those population has been increasing here as far as the residents in Nevada. So what's happening is that instead of going all the way to Texas, you know that they have the Center for Excellence in Cancer Center in Texas. So now they have the Cleveland Clinic now that they can do the telehealth and they can do a consultation with the expert, whichever
Mm-hmm.
condition that they have, and then they do the telehealth and they don't have to travel. So they can get the
Right,
consultation and even some treatments. So it's really minimizing all the stress and traveling, minimizing the cost also, right? You mentioned about
right, yes.
lodging. Yeah. So it's really
Mm-hmm.
is
And they can even see, because our doctors will go over their PET scans with them. They'll sit there with the patients and show them their PET scans and show them exactly, what they're looking at. And they can even do that through telehealth. They can, share that screen with them and show them their PET scans and CT scans with them as well. So it's that we've come a pretty long way with our technology these days. Thank goodness, because who would have known we were going to come into a pandemic and really need it.
yeah, so it seems like everything was already in place, and all we have to do is conform with the rules and conform with the advice of CDC, you know, and advice of WHO, because it's a global pandemic. So not only that we listen to CDC, which is a more national, we also have to listen to World Health Organization and their take about this because they know what's happening worldwide. And I think for our listeners out there, you know, please, you know, get yourself familiarized, educate yourself. I mean, the media, the advanced technology is so vast, and then be an advocate for yourself too. You know, if there's information, like I know that something comes up on TV or in the media or social media, that if they take this then they won't be susceptible to COVID. And you just have to be smart in
Right.
sifting through those information. And I was thinking what else that I could start that I can say, but I think for the most part, I think that we need to gear towards the prevention, because reactionary is we do the tertiary when the disease is already developing,
Right.
or when you already have cancer, and that's when we have to treat it, or it's non-treatable, and then now you have to go through palliative care. So I think the focus now is in prevention.
Yes, and with COVID going on, and I see people that smoke, and I'm like, they're still smoking, and this is a lung illness, and I'm like, how can you be smoking? You want to take care of your lungs now more than ever, but this is also a time where depression and anxiety is at an all-time high, and that's all they got. Like,
Mm-hmm.
they need that. And this month is also Mental Health Awareness Month,
Yes. Yes.
and I think lung cancer especially goes hand in hand with mental health. Suicide rates are very high among um, lung cancer patients as well, and they need to be screened. And I just wish we had more for people that are wanting to quit smoking. A lot of times they're doing it because of the anxiety or depression, and I
Yes.
just wish we
Yes.
had something like that. But I think motivational motivational interviewing is the way to go to help get for tobacco cessation, especially because there's so much information out there why smoking is so bad for you. People know that smoking is bad. They know that it causes lung cancer. The word is out.
It's yeah.
They just need to have some kind of motivational interviewing.
It's funny that
We're
it
losing
just
you.
popped in my mind where
We're losing you.
traveling into when I was still working. Asking me, okay, am I
You
still on?
You got to repeat what you
No?
just said because we didn't hear it.
Oh, I just said that while you were talking about just smoking cessation, it's funny because when I was working at Queens Medical Center in Honolulu, Hawaii, I would be on a break because it has been have a no smoking area or no smoking zone. So I looked out and some are wearing their scrubs, and then across the street where respiratory therapy is smoking. So I'm just saying the difficulty of trying to quit smoking does not only pertain to ordinary people. Healthcare workers are also humans, and so they're also susceptible to having a hard time quitting smoking. And so when I look across the street, I go, oh, that's so and so. Oh, that's a group of respiratory therapists having us smoking. So
Well,
I just wanted to say that.
well, I was in the military. I was in the Navy in my younger days, a long time ago, and it was very prevalent in the Navy as well. And I didn't smoke, but I worked with a smoker and a few smokers, and they would go and take a break like every hour for 15 minutes. And it was like, wait a minute here. I'm gonna smoke too if because I wasn't getting a break every hour. I was like, I'm gonna go smoke too. I want a break.
Yeah,
So I did that for a little while.
Yeah, and our stories that we're sharing to our listeners out there is to humanize also the healthcare workers and the struggles also the healthcare workers, as it is as much as a struggle for our population who are high risk for lung cancer. And I also wanted to share that, as nurses, we try our best not to be judgmental. And I remember one last story that I would share is when I was still a nursing student, and I happened to be assigned to someone who is in last stage of lung cancer and actually given palliative care. Well, not quite palliative care yet. He's still receiving treatments. And the doctor had prescribed a pass to be able to go smoke break. And that really was a struggle for it was an ethical dilemma for me. And how could the doctor allow this? And I
What
think,
did he allow? We didn't hear that part, I don't think.
The doctor had written an order for a pass to allow this patient who had been diagnosed with lung cancer
to go
in the
smoke.
hospital to smoke. And I couldn't understand that as a nursing student. And later on,
Right.
as I mature and got to take care of more patients in the similar situation, then I realized patients' rights.
Yeah.
If that is, especially if they're told that there's nothing else that we can do for you, then it's the same thing with patients who were diagnosed with diabetes and all other conditions. Just give them what they want. I mean, that's the care of holistic care of mind, body, and spirit. We can address their physical needs, but we're not addressing their emotional needs. And you mentioned about depression. And a lot of these preventable chronic diseases are attached to mental health and that cause depression, for so many various reasons. That would be another segment or another broadcast that we will do for the month of October for mental health. But today we are increasing the awareness of health lung Lung Health Awareness Month as October. So this is something that's very important for our listeners out there, mga kababayan. So any time flies when we're having fun. It has been 30 minutes.
That was really
I wanted to ask
fast.
Angie. And yeah, it is. Any words of wisdom for our listeners out there regarding Lung Health Awareness Month?
Get out there and exercise your lungs, increase your lung capacity, like Mary Faye here is doing. I went out on the hike last night. Very stay inside when the weather tells you now if the air quality is good. Watch that, and whole health is a big thing right now. Just take care of yourself, take care of your whole self, your mental health, your body, everything.
Wear your mask.
And wear your mask for yourself, for others, and stay 6 feet away. And
yes,
I hope
physical
everybody
distancing.
stays safe out there. Also, if you're in Oregon, please vote for the legislation to ban the flavors on vape.
Oh, okay. Yeah, I know high school students are. That's another segment that we'll have to.
It's decreasing.
Well,
we need it. We need it passed here in Oregon. Everywhere else, it's they've got it banned, but here in Oregon, we need to ban it still, and it's coming up for voting.
Yeah, well, Angie, thank you so much for being our guest tonight, and
thank
I wanted to
for having me, Mary Faye.
And please come back for a next segment for any specialty or any information that you can share with our listeners out there. And really, time flies when we're having fun. After this broadcast, I'm gonna continue walking and then go back to my office and finish grading. So anyway, so mga kababayan, so also PHLB Radio. Thank you for your partnership to bring this important information to our listeners out there. That is our mission and vision. So remember, our listeners, every Monday is a healthy Monday. Aloha.
Aloha.
The Asian American Pacific Islander Nurses Association of Nevada has just brought you Healthy Mondays with Apina of Nevada.